So our final presenter is Dominick Lanzito. And Dominick has been the elected chairperson of the Bloomingdale Township Mental Health Board, except for a short period of time, since its inception. He's a longtime resident of the Bloomingdale Township community with an equally long history of service in the community. So Dominick has served as an assistant state's attorney conducting over 150 bench trials and currently is a partner in the law firm of Peterson Johnson Murray, where he serves as general counsel to multiple municipalities. And we're very fortunate to have someone with his depth of knowledge and commitment to service leading our mental health board. So Dominick, can you tell us and wind up the evening, highlight for us the many grants awarded this year and how the grants fit into the 1- and 3-year plans that you update every year?
Exactly. So just to briefly touch on the introduction prepared by Michael, we are appointed board members, and I think by default I was elected by the other board members as the chair. Basically, everyone took a step back and did one of those reasons. So, yeah, I don't think there wasn't any other option, so I was the default. And I know there's a couple points this evening that everyone wants to touch upon. Is what's the requested need and what are we able to help with? What are some of the grants that we provided? The 1- and 3-year plan, which we have to update every year, and I think Diane can speak to this. One of my other, one of the other cogs on our board that is always working, is always involved, and she makes everybody look good. So our plan has evolved because when we started this in 2017, we had to do a needs assessment. We had to determine, what the issues were, and the hardest part is to say that one group is more needy, or one cross section of the community is more needy than another. You have respite care, you have early child intervention and assessment, and of course you have mental health services for adolescents and teens and adults, and then you couple that maybe with some of the other concerns of addiction and drug abuse, and you kind of put all that together and you try to figure out, okay, where's our plan at? And I think most recently, one of the grants that we gave 2 years ago to Dr. Huber was to determine, and it's part of our criteria, that we don't want to duplicate efforts. We want to utilize our funds and utilize the public coffers in a way that maximizes, the most bang for the buck, so to speak. And she did basically a triage of the services that were provided to eliminate overlap. And I think, from my perspective, when she's going around kicking the tires and ensuring that, and this will get into where Dawn made the joke about Dominick loves his numbers. You need to understand the quantity of services being provided, but also the quality of services being provided, and integrating those services, because everyone is working in their own silo. You sort of put your head down. So our most recent plans is we want to integrate these services, and that's where we're going to have the youth network, so that not only do people have access, they have, perhaps when someone goes to see Dawn, if it doesn't fall, and everything falls in Dawn's wheelhouse, or in skill set, but if there's another service available that can get this individual, this adult, this child in, she's able to know within moments where the best fit is. And I think that lends itself to, it's a direct result of the work that Dr. Huber's done, and others in the community. And I think when we started this board, I truly think there was a lack of, I was ignorant to a lot of the issues, but there was also, I think, a lack of knowledge amongst the other providers about what everyone else was doing in the community. And I don't think that was intentional. I think that was just, you're chopping the wood, you're carrying the water in your space. And I think this 708 board, as part of our 1- and 3-year plans, has allowed the community to, not only does the community as a whole have a better idea of mental health issues, I think the mental health providers themselves now have more visibility as to who the other providers are in the community, even more so than they did before. Not to say that they didn't, but I think now there's a greater awareness of everybody around it. I have some of the numbers, and the one thing I say I'm particularly proud of with our board, and I was a commissioner on the Roselle Fire and Police Commission for almost a decade before and actually some overlap with this particular board. So a lot of the police reforms that you're seeing, and it became very relevant in 2020, and so we were ahead of the game when Netfis and Roselle and other communities were utilizing in their policing, or as part of their policing, social workers, and it had a dual purpose, not only for the community, but a lot of times for the officers. There's always been a need when there's like a police-involved shooting that the officers placed on administrative leave, they go through a psychological analysis, but even it's become more recognized that the officers are going through so much, and I think having social workers available now that the public is knowing that our police departments have these services available, I think it's actually de-escalated some of the tensions between the community and police officers when they're responding to certain calls. So
I would agree a lot.
So from my perspective, I think it's made it safer for the community. I think it's definitely made it safer for the officers. And again, it's that integration of services and sort of being a trailblazer in our township, being a trailblazer in that regard, because 3 years later, everyone was talking about social workers in the police department, but we had to put those social workers in place. Some of the grants that we provided, we've done it we've had a lot of grants, and so I have my cheaters now, so my eyes have been failing me. And as we look at everything, so yeah, the total numbers, and I'll start with the totals. There was a request of $1.68 million last year, and we were able to provide grants of almost $1 million, $998,000, some change. And as part of our 1 and 3 year plan, we wanted to grow our services, but we wanted to do so in a responsible manner. And I think from our perspective and from the board, and I don't want to speak for the whole board, but that they feel that we've done it in a responsible manner. And we've been able to provide the services at every level. And the pandemic has destroyed a lot of those services. And one that was close to my heart was the senior care at Trinity. I had family experience with it, and I thought it was a wonderful institution, but they had to close down because of COVID. I know, ABC had a facility for youth, and it was very difficult to get students in, and so the stress that goes along with those. But as part of our plan, we need to press on and kind of replace, if we can, those services and make sure they're available.